What stimuli are used in evoked potential tests? Imagine a way for doctors to peek inside the nervous system and see how well signals travel through the body. That's what evoked potential tests do, especially when diagnosing multiple sclerosis. These tests use specific stimuli to trigger responses in the nervous system, helping identify areas where nerve signals might be slowed or disrupted. The most common type is the visual evoked potential test. During this test, a person looks at a screen showing a checkerboard pattern that alternates or reverses colors. The pattern reversal is especially useful because it stimulates the visual pathways from the eyes to the brain. Electrodes placed on the scalp record how quickly the brain responds to these visual changes. If the response takes longer than usual, it could suggest damage in the optic nerve, which is common in multiple sclerosis. Another type is the brainstem auditory evoked potential test. Here, a person listens to a series of clicking sounds or tones through earphones. These sounds stimulate the auditory nerves and pathways in the brainstem. Electrodes on the scalp measure the brain's electrical responses to these sounds. Delays or abnormal responses can point to issues in the auditory pathways, which can also be affected in multiple sclerosis. The third main type involves somatosensory evoked potentials. This test uses mild electrical pulses applied to the skin, usually at the wrist or knee. These pulses stimulate sensory nerves in the arms and legs. Electrodes record how quickly signals travel from the skin to the brain. If the responses are delayed, it might indicate nerve damage in the sensory pathways, which is another hallmark of multiple sclerosis. During all these tests, electrodes are carefully placed on the scalp and sometimes on the limbs to pick up electrical signals. The stimuli are delivered in controlled ways, visual patterns, sounds, or electrical pulses, and the timing of the brain's response is measured. The key measurement is latency, which is how long it takes for the response to occur after the stimulus. Abnormal latency or reduced response amplitude can suggest nerve damage. These evoked potential tests are valuable because they can detect subtle nerve damage that might not show up on other scans or exams. They are often used alongside magnetic resonance imaging and clinical assessments to build a clearer picture of multiple sclerosis. They also help monitor how the disease progresses or how well treatments are working over time. It's important to remember that evoked potential tests are just one part of a comprehensive diagnosis. They provide important clues but are not definitive on their own. Always consult with healthcare professionals for personalized advice and diagnosis. These tests are safe, non-invasive, and can give valuable insights into how the nervous system is functioning in people with multiple sclerosis.